Harshita here. So today I'm going to be talking about tuberculosis infection, colloquially known as TB. So tuberculosis infection is caused by Mycobacterium tuberculosis bacteria, and it is very commonly known to affect your lungs. And in fact, India unfortunately is considered to be one of the high prevalence countries for tuberculosis infection. When we talk about tuberculosis causes, of course, the bacteria, which is Mycobacterium tuberculosis bacteria, is what causes the infection. And especially people who have lung tuberculosis, when they cough or sneeze or talk, they kind of spread the bacteria like an airborne infection. And then people who are in close contact with them can kind of get infected by this bacteria. And depending on their immune status, they might manifest the symptoms now or later on when their immunity comes down. Other very common causes or tuberculosis causes can be people living in crowded, small homes which have poor ventilation, no sunlight coming in. And apart from this, babies and young children who are younger than 4 years of age, people who have chronic diseases like, say, diabetes, autoimmune disorders, or even HIV infection, very, very commonly associated with tuberculosis infection. And then people on immunosuppressive drugs like, say, steroids or cancer chemotherapy drugs are all at a risk for contracting this infection. Tuberculosis symptoms, well, there are some very common symptoms of tuberculosis, which is low grade fever. So the fever in the initial days might be slightly more higher grade. Sometimes you might have shivering, but the fever tends to last for a long time, especially more than 2 weeks or 3 weeks, or even after a month, up to a month if it's not diagnosed or picked up early. And the fever characteristically rises at the end of the day, or what you call an evening rise of temperature. And you might have something which is known as night sweats, which is a lot of sweating at night. Apart from this, you may have a loss of appetite. You will definitely have unintentional weight loss, which is to say you're not working towards weight loss, but it is happening. Then, apart from these common symptoms of tuberculosis, you might have some organ specific symptoms. Like if you have lung tuberculosis, which is one of the most common and otherwise known as pulmonary tuberculosis, you'll have a cough which lasts more than 2 weeks, and you bring out copious amounts of sputum, and the sputum can sometimes be blood stained. Other organs, like, say, if your brain or your nervous system is affected, you might have a headache, you might have vision disturbances, you might have altered behavior or even coma. Then you can also have tuberculosis of your heart, where you might have a lot of chest discomfort, breathing difficulty. Digestive system TB infection can cause much more loss of appetite and weight loss. You can have nausea, vomiting, diarrhea, these kind of symptoms. Then when you have a TB of your kidneys, of your urinary bladder, you might have blood stained urine for a very long time. If you have tuberculosis of the reproductive system, you might have infertility. If you have TB of your bone or skeletal system, you might have bony pains, restricted movements. So these are some common symptoms which are associated with each and every organ. Of course, from person to person, the symptoms can be different, but this is what is commonly seen. Now, tuberculosis diagnosis, well, there are a battery of tests available, starting from a simple skin test, which is basically a protein derivative is injected into your arm, and we measure the swelling, or what you would call induration, in about 48 to 72 hours. But there's a risk of false positives, especially in a country like India, where there's a very high prevalence rate of tuberculosis, or even if you've recently taken a BCG vaccine, it can come false positive. It can come false negative in elderly people or HIV positive people in whom the immune system is compromised. Sputum microscopy is considered to be one of the best ways to diagnose tuberculosis, especially lung tuberculosis. So we collect an early morning sputum sample. You might be advised to give 2 samples back to back, or you might be advised to come on 3 days early in the morning and give 3 early morning samples. As soon as the sample is collected, it's taken to the microbiology lab, where they stain the sample, view it under the microscope, and pick up the presence of the bacteria, the TB bacteria itself. And the advantage with this test is that the results are available within a few hours. Then, apart from these, there are some newer tests also available, which are blood tests. So interferon gamma assay tests, like TB quantiferon tests, are also available. So with these tests, of course, it's easy, it's convenient, it's a simple blood test, and it's usually advised when you want to diagnose latent tuberculosis. This might also be one of the tests that's advised that you get done for screening of tuberculosis, especially if you have to travel to foreign countries or study in foreign countries. Then we also have nucleic acid amplification tests known as gene expert tests, and the advantage of these tests is not only are they diagnostic of an active tuberculosis infection, they will also tell you a little bit of the drug sensitivity profile. You can also do a sputum culture. If sputum is, that is basically if you have a lung tuberculosis, you can do a sputum culture, but that might take anywhere between 4 to 6 weeks for a result. So it takes a very, very long time for this bacteria to grow. There's some newer methodologies in this, which are known as BACTEC method, which can give you the results in a much, much faster time. Some radiology tests may be advised, like X-rays or MRIs. They might also collect samples from a certain parts of the body, like a urine sample, a blood sample, or even a pus collection. So all these samples are collected, they're sent to the microbiologist, who will do the relevant test and give you the result. Tuberculosis treatment, well, the treatment is very, very long. It can be anywhere between 6 months and goes up to sometimes even 24 months, depending on what type of infection you have. So if the tuberculous bacteria is sensitive to the drugs which are normally prescribed to treat this infection, the duration of treatment may not be as much. But if the bacteria is actually resistant to the normally prescribed medication, the duration of treatment does get extended. And the number of drugs are a lot more. It's not like you can take just one tablet and you'll be cured of the infection. Different types of medications are given. The first 2-3 months is what you call an intensive phase of treatment, where anywhere between 3 to 4 drugs are given. And then after that, the drugs, after the intensive phase is done, some of the drugs are taken off, and few drugs are continued for the duration of treatment. So very important to remember, take all the medications that are prescribed and take it for the duration that it has been prescribed for. Tuberculosis prevention, of course, you have to be a stay in homes, or ensure that your home is well ventilated. There's a lot of sunlight coming into the home. There's not too much of crowding. Get your daily sun exposure for about 20 to 30 minutes every day. If you have any chronic health issues, please take your medication. Don't neglect it. Don't let your immunity get compromised. Especially in HIV positive patients, please take your antiretroviral therapy, because if you don't take your medication, the CD4 count falls down, which is basically your immunity falls down, and they're at very, very high risk of contracting this infection. So at the end, of course, TB or tuberculosis infection, very, very common in India, very slow growing bacteria, can actively manifest symptoms, maybe a latent form. Treatment or duration of treatment is very, very long, so you have to take those medications. There might be a few side effects, but you always have to think about risk versus benefit. There's a whole lot of benefit if you actually take your medication, because you'll be cured of the infection. If you neglect it, it can cause health complications, which might require you to get hospitalized, and could also be life threatening. So this is not an infection that is to be taken lightly. Free diagnosis, free treatment is offered at government hospitals, state-run hospitals, RNTCP centers, DOT centers. So definitely, if required, you can avail of those facilities as well. So thank you very much. If you have any further questions or doubts, please feel free to reach out to us or leave a comment at the end of this video. Thank you.
Don't forget to like and share this video. For more such videos, do subscribe to the MFine channel and hit the bell icon to never miss any update.